1 in 4 pregnancies end in miscarriage. Yet, it remains a topic very few talk about. In this episode of In the Know, Nikola Simpson shares her experience with pregnancy loss, her journey to healing, and her hopes of becoming a mother. Nicola, thank you for agreeing to this very personal interview with me. Tell me how far along you were in your pregnancy when you miscarried.
I was 9 weeks and 4 days, and I had gone to the doctor for a routine checkup, and no heart rate was detected. So we had to wait a painful 4 days to go to a radiologist to confirm that. And it was then confirmed that there was no cardiac activity. So it was what was called a missed miscarriage, because there were no signs or symptoms that I was going through the process. I was still getting all of the pregnancy symptoms that I had. And once that happened, I wanted to miscarry naturally. And I think luckily for me, it started naturally, but then I had excessive blood loss, so I had to go for medical intervention under anesthetic to complete the process.
You spoke about the process, so let's backtrack to the beginning. When did you find out you were pregnant?
Found out that I was pregnant just about a year ago, and my partner and I had been trying for a few months. We were. I think the first reaction, I literally, my period was late by 2 days, and I think quite connected with my body, and I have been quite connected with my body and how I feel, especially for the past year and a half. So I've been tracking something called your basal body temperature every day, and I started to notice some symptoms already, like nausea or tender breasts, things like that. And we were really excited, but also quite surprised. It was a mix of emotions for sure, but really excited and ready to welcome a little baby into this crazy, beautiful thing called life.
You found out pretty early. What were those initial weeks like? The thoughts you had, the feelings, the symptoms?
I mean, I am someone that usually can overanalyze things, but during this pregnancy, we never thought that it could happen to us. So we tried to, embrace it, and just already was on a journey of making sure that I was as healthy and as happy as possible. So continue to do that, but with a bit more effort and focus, and really making sure I was putting myself first, and trusting my body for the baby. Unfortunately, like many women, I felt quite sick for those first few weeks. Extremely nauseous, vomiting every day, extremely tired, all the symptoms that you hear many women experience. So I spent quite a few days in bed or eating crackers. But even like within that, although I felt so exhausted, we were just really, really excited, but on the other end, also very calm and ready and present, and just really trying to enjoy the experience as much as possible, and do all that we could to make sure that we were healthy, and the baby, we were doing everything we could to make sure the baby would be healthy.
You mentioned that it was through a routine checkup that you found out. Talk me through that day.
Yeah, so when we went in for that 9-week checkup, and at first you go in, and as I said, neither of us thought that it would happen to us. So we went in thinking, okay, we're going to hear the baby's heartbeat. And, I remember it quite clearly. At first it started like a routine checkup, but then he couldn't find it. So then had to kind of search for it some more. And at that moment, I think both of us kind of knew that something might not have been quite right. And I remember feeling definitely a mix of emotions, but probably the deep pain and sadness was like the first thing, but also confusion, and also still a little bit of hope, because when we were told there was no heartbeat, we knew we had to go now to a radiologist, and they had to do further, analysis. So there was still some hope, but those 4 days that we had to wait, because it was actually like a Thursday and then a weekend, were probably some of the worst 4 days, because you kind of knew what might have been happening, but then at the same time there was still some hope. And I just remember a lot of crying, literally on the floor in the shower. It was a lot of emotions for sure.
And obviously you weren't going through this alone. You shared about your partner. How important was that support?
Yeah, so grateful to have that support. I don't know how women go through this alone. So he was there with me at the checkup, and we came home and like had each other. We had our dogs, which really helped. We tried, both very connected to nature, so tried to spend time in nature. That also supported me a bit. I told my mum, so I had, and one of my best friends, so the people closest to me were aware, and it really helped having that support within those days, because even with that support it was still horrible.
How has healing been for you? What did that look like?
Yeah, so for me, healing was a combination of things, and I think it's a process that's ongoing for me. So one of the first things was obviously having that support and that comfort from my partner, my mum, some of my closest family. And then another big part of healing for me, once I felt comfortable, it was after 2.5 weeks, I started to share my story. So I created an anonymous Instagram page, and that actually connecting to community both here in Barbados and the region and globally was probably one of the things that helped me the most to realize that this is something that is so common. Depending on what statistic you look at, so many women, individuals go through this, and that really helped me to start to share my story in that way and connect with others. I was going through the process. It's not like there's a timeline on grief or how you feel, and acknowledging that there was this baby, there was this life, this future, this dream, and part of that comes with acknowledging the day that the baby would have been born, my due date, which would have been April. And we actually went on that day and just planted a little something. So doing stuff like that, I think helped, because I think no matter what time a woman has a miscarriage, whether it's at 5 weeks or 22 weeks, it's painful, and it was a life. It was a future. So I think it's important, if you feel brave enough or comfortable enough to acknowledge that. And for us, it helped to use a name, or I got a little Christmas decoration at the time made, or planting a tree, just that they're memories.
You were able to get pregnant after that miscarriage. Was there anxiety there when you found out?
Yeah, there was a lot of anxiety, and we discussed whether we wanted to try again. I am someone traditionally that would get anxious or overthink things. So now that this had happened to me, and I knew that it was a possibility, I did feel even more anxious that it could happen again. But at the same time, I wanted to try to give it, give this process, this journey, the best chance. So I tried again as much as I could to speak about it, to do yoga, to do meditation, to eat well, to really try to enjoy the journey again. But when we found out, the emotions were different this time. There wasn't as much excitement, because it was like, can I really go through this again? Physically, mentally, emotionally. And that's part of the reason we waited until we both felt comfortable, and especially me, to try again, to know that I was in a better headspace to be able to deal with it, because I'm still emotionally, mentally, physically exhausted from the process. But there definitely, anxiety was one of the key emotions or feelings, but I tried to do my best to not let it take over.
When did you realize something was wrong?
Pregnancy did start off, I would say, quite rocky, because I had taken a pregnancy test that was positive, and then I took another one that showed negative. So once that happened, I reached out to my OB, and he sent me for blood work. So I was going for blood work every few days to monitor levels. And then I did have some spotting, and it could have been normal, because that can happen during early pregnancy, but that continued. And that was the first signs. And then the bleeding continued and got much more heavy. So I pretty much knew what was happening. And knew that I was going through this process again, even if I couldn't believe it. I started to miscarry naturally, but to make sure that everything was okay, I had to go to the doctor. And he shared some information with us, because of course one of the first questions that we both had is why again, what's happening, is there something wrong? So he shared some resources, some information on maybe why I might have now had 2 miscarriages in a row, and also sent me for a bunch of blood work that I went just up until last week to get. And I have to get more blood work. So trying to find some answers, on whether it's an autoimmune disorder that could be causing this, or, if we try again, is it that I need to take injections every 3 days to keep the pregnancy? So we had some more answers from Dr. Best on, how to maybe proceed and maybe why this might be happening, which helps. But of course, I'm still waiting for some of those results to have an answer.
Even as you wait for answers, after those losses, are you hesitant to get pregnant again?
I do feel, more nervous, more anxious, because to keep going through this, I don't know how women, like, one is hard enough, then two, I don't know how some women go through 5, 6, 7, or try for 10 years, because it's, as I said, the physical part is hard, the pain of that, but it's the emotional, mental part, that really, really affects it. It's a mental health conversation as well. So, we have talked about, we want a child, we want a family. So that's there, but it does cross your mind, like, am I able to go through this again, or will it ever happen? So those are really hard feelings and thoughts to have to face and kind of sit with.
Are you open to other options? Fertility treatments, perhaps?
Yeah, we're definitely open to things. Obviously, the first choice still is to be able to conceive naturally, and currently where we sit, I can get pregnant, but I can't, keep or hold the pregnancy. But I think once I get the results of this next set of blood work and know what is maybe happening, then we can have bigger conversations surrounding that. But both of the OBs in the clinic that I went to, have shared some other alternatives with me. So it's conversations I've had and I'm open to.
What do you want women to take away from this interview?
I think, this is definitely one of the hardest things that I've been through in my life. And although, I had amazing support, I still felt so lonely. And there were those mix of emotions. One of the first things you think is something wrong with me? Or some women feel shame. It's a conversation that I think people are not having enough on a national and global platform. There's definitely been progress, but I want women to feel, brave and empowered, and to feel seen and to feel heard, and to know that they're not alone. Although it's probably one of the most lonely journeys that you might go through, know that there's so many other women going through that, and individuals, partners, communities. And that's something that I'm learning, even when I started to share my story, everyone you speak to has either been through it, knows someone. And I had so many, like hundreds of people reach out to me just in Barbados, that they had been through this, and people that you would never know, a close friend, a family member, because I think it's still a topic that so many people are not speaking about. So I think that's the first thing I want women. It's a hard thing, so you can't expect everyone to feel safe or brave or comfortable to share, but to know that it's okay to share, that you're not alone, and that this is something that unfortunately happens to so many women, and that there is support. What I've really realized is, to have a healthy pregnancy and a healthy baby is such a blessing and a miracle. And I almost feel on the flip side of that, we need to have these conversations surrounding loss and grief. I don't think our society is very good at talking about loss and grief in general. So that's another thing that I would like women and our society to learn from this, that it's okay to speak about these things and to ask for help. And if you're going through it, to know that you're not alone, even if you feel lonely.
Nicola, thank you for your time and for being so candid. When we return, OBGYN Dr. Damian Best sits down with me to talk about miscarriage from a medical perspective. Stay with us. Dr. Bass, can you share the statistics as it relates to miscarriages in women?
Miscarriages are a common complication of pregnancy. It's been recognized that miscarriages can occur in up to 10 to 15% of all recognized pregnancies. This seems to equate to about 23 million pregnancies being lost to miscarriage per year. And some statistics even say something as many as 44 internationally per minute. Those are startling statistics, Krystal.
Is there local data available?
Unfortunately, no, there's not any local data at the moment. Although, internationally they are recommending that we have registries. There's not currently any registry in Barbados. The sad fact is that most miscarriages would not occur in a hospital setting where statistics and research are readily applied. A lot of miscarriages would take place out in the community, in persons' homes and so on. So those wouldn't tend to be easily captured for publication.
But you're a doctor at the Queen Elizabeth Hospital. Do you see a lot of cases of miscarriage?
Yes, we do see miscarriages coming fairly frequently. The ones that end up coming to the hospital would be usually the more complicated cases, those with a lot more of the pain and heavy bleeding, passing clots, passing bits of flesh material and so on. More frequently we would see what we call incomplete miscarriages or inevitable miscarriages, maybe even those which are complicated by infections and septic miscarriages.
You mentioned incomplete and inevitable miscarriages. Can you explain those?
So when it comes to classifying miscarriages, the miscarriage which has bleeding, all the tissue has been expelled from the uterus, tends to result in absence of pain and close of the cervix and the bleeding slowing down to a stop. That's called a complete miscarriage. So an incomplete miscarriage, on the other hand, is when perhaps some of the tissue, placental remnants or embryonic remnants or so on, haven't completely passed, and as a result the woman persists to have pain and heavy bleeding associated with things like clotting and passage of fleshy material. And when we examine them, we might see that the cervix is still open and we can see that pieces of tissue are still being retained or passing. Another category of miscarriage would be the missed miscarriage. So in these occasions, maybe the woman has come in incidentally for a checkup. It could be in the first or second trimester. Everything seems to be okay. She's had an ultrasound and either the pregnancy sac is empty or the embryo has no heartbeat. So this is called a missed miscarriage. Management options for these and the other types of miscarriages we mentioned, like the incomplete, tend to vary based on the preference of the woman and also the expertise and equipment and so on available. So for example, the woman might elect for what's called expectant management, which is kind of a wait-and-see approach, with the expectations that many miscarriages will complete themselves on their own without any need for additional interventions. There's also medical management of miscarriage. So in that case, we would use certain types of tablets, maybe inserted or taken by mouth, and these should help to contract the womb, contract the uterus, so that the remnants of the pregnancy are expelled. So this might take a bit of time and could be complicated by heavy or excessive bleeding, in which case, similar to the incomplete miscarriage, which can sometimes also be medically managed, by the way, you might need to evacuate the uterus a bit more quickly. And this is where surgical management comes in. So traditionally, we've spoken about DNC, or dilatation and curettage, where they take metal instruments, maybe insert them into uterus, and basically tease the bits of tissue out. In modern times, and with better equipment availability, they tend to use a bit more of the vacuum aspirations, and those will include electric vacuum aspirations, but more recently we've been finding a great use for manual vacuum aspiration, particularly recently being introduced into the hospital. So these tend to be a bit gentler, require less anesthetic, maybe can be used as an outpatient, so the woman doesn't need to be admitted. So a lot of cost savings and time savings there. And it tends to basically use suction with a syringe to quickly and gently evacuate the tissue, right? And it tends to result in quicker resolution of the symptoms, the pain, the bleeding, and quicker return of the woman to normal lifestyle as much as she can. Although we do recognize that a lot of these women do have emotional needs, might need some time away from work, psychological support, and so on. But that quicker resolution of pregnancies, we find, does help them with part of that grieving process. We do recognize that miscarriage can be devastating, not just for the woman, but also for her partner, her support system, and so on. It's quite easy, I suppose, seeing miscarriage in clinical practice to almost normalize it, which is really something we really shouldn't do, because yes, there's a great emotional component that goes into hopes and dreams about a coming pregnancy. Unfortunately, we don't have a structured miscarriage support system in our clinical practice at the hospital or locally, but there are informal miscarriage support groups available online, Facebook, Instagram, and so on. And we do have counselors and psychologists for general purposes that can be used for support of couples as they need.
Dr. Bass, I want to talk about the causes of miscarriage.
So most miscarriages are sporadic. We call those sporadic because they happen unexpected, unannounced, unexplained, right? And it tends to be maybe a one-off, never occur again, right? The chance of a woman having a first miscarriage is about 10%. So very often, like I said, there's no explanation for the miscarriage, although it's thought that there might be some genetic component where maybe there's a combination of father and mom's genes which is incompatible with life.
Is there a way to prevent a miscarriage or stop a miscarriage from happening?
So there is a class of miscarriage called threatened miscarriage, where the woman has come, she's had some bleeding, and you've done an ultrasound and everything looks fine, right? So the heartbeat, baby's intact. Those have been the focus of the PRISM trial in the UK, right? And it's found that if anybody's had a miscarriage in the past, they've had some bleeding, that using progesterone supplementation. Progesterone is a hormone which tends to keep the uterus from contracting when you're pregnant. Progesterone inserts into the vagina were used in their trial, and they were demonstrated to improve the chance of having a live birth. So in that light, some of the miscarriages, not all of them, could potentially be prevented. In the case where there is an inevitable miscarriage, we mentioned that earlier, inevitable miscarriage tends to imply that the cervix has opened up, so maybe beyond 3 centimeters dilated. She's continuing to bleed, she's continuing to have pain. In those cases, there's usually nothing that we can do to prevent the miscarriage, hence the term inevitable. So the only type of miscarriage potentially that seems preventable would be the threatened miscarriage, which is basically just a term applied to bleeding where the cervix remains closed and the baby's heart rate remains intact.
And speaking of that, are there signs that pregnant women should be looking for?
The most common sign that pregnant women would detect when in face of miscarriage would be vaginal bleeding. Although vaginal bleeding can be quite common in pregnancy due to implantation and so on. But bleeding along with abdominal pain tends to be a bit more of a warning sign that things might be a bit more progressive than just the threat of miscarriage. So should the woman have crampy abdominal pain, bleeding which is progressing, maybe it's bright red, maybe it's getting worse, maybe she's having a passage of clots, fleshy material, that would be an indicator to me ladies should really seek medical attention because she's more likely to miscarry.
What is the likelihood of multiple miscarriages?
So recurrent miscarriage is defined internationally usually as 3 or more miscarriages, right? These could be in the first trimester, for 12 weeks. These could be in the second trimester. Overall statistic tends to be somewhere between 0.7 and 1% of miscarriages can be recurrent.
How do you respond to a pregnant patient who has had a miscarriage before?
So I would say truthfully, as a doctor, you've seen a patient, she's had a miscarriage in the past. You kind of walk on a bit of eggshells, when she's coming back. And you have to be as supportive as possible. There's a role for early and repeated ultrasounds for reassurance, both the patient and yourself. You kind of have to manage expectations, but there are things, as I mentioned, can be employed for people, particularly that have had their recurrent miscarriages and so on. There is a role for progesterone supplementation and those kind of things. And yeah, I think you go in there with your fingers and your toes crossed, and you pray and hope for the patient for the best. I don't know if I can say much more than that, Krystal.
There are lots of misconceptions surrounding miscarriage. What would you want to clarify for women?
So I would want to let them know that very often there wasn't anything that was done wrong. There wasn't anything that could have been done to predict or prevent miscarriages. I would like to let women to know that very often the misconception that they did something that they're to blame is absolutely false, right? There's not usually any fall or any trauma or anything like that resulted in the miscarriage. It's unfortunate, and it is, as I mentioned, unpredictable in many cases, unpreventable. So I would want them to not blame themselves.
Online, more and more support groups are being created to provide a safe space for women, grieving, healing, and hoping. Thank you for joining us.